Hello, well-intentioned humans, and welcome back to the show that keeps validating the suspicion you have been quietly carrying that maybe doing more is not actually the answer. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has spent years watching people arrive in her clinic not because they neglected their skin, but because they tried extremely hard to take care of it. Dr. Lazuk is not with us today because she is currently at a dermatological education summit in Vienna, Austria, having accepted an invitation to present on what she described as the clinical consequences of effort-based skincare culture in the United States. She delivered her presentation. It generated what attendees are describing as the most recognized collective experience this conference has ever produced. Apparently, a significant number of dermatologists in the audience began nodding before she finished her second slide. She has since agreed to extend her stay, review a proposed curriculum revision for barrier health education, and co-author a statement on microdosing protocols that the organizing committee describes as something the field has needed in writing for at least 5 years. She is, by all accounts, energized. We have sent a later flight. She has not looked at it. This is, at this point, expected. So, you have the avatar, and today we are talking about a shift that is happening across dermatology right now that is long overdue, and that explains something a significant number of people have been experiencing without having the language to describe it. Let us start with the belief that shaped skincare culture in the United States for a very long time. If something worked, you should feel it. Tingling meant it was active. Redness meant it was strong. Peeling meant it was effective. The more intense the reaction, the more confident people felt that they were doing it right. Results were supposed to announce themselves. And for a while, that approach seemed to make sense. Skin turned over faster. Texture changed quickly. There was a visible sense of something happening. Here is what Dr. Lazuk has been seeing more and more over the past several years. Patients who did not ignore their skin. Patients who tried very hard, who used good products, who followed carefully researched routines, who rotated acids and retinoids and vitamin C and devices and optimized everything available to them, and whose skin is now irritated, reactive, red when it should not be, breaking out in patterns that make no logical sense, sometimes thinner than it used to be, sometimes suddenly sensitive to products that cause no problems whatsoever for years. And the moment that Dr. Lazuk finds most important in those conversations is when those people say, with genuine confusion, that they are doing everything right. So why does their skin feel worse? That question deserves a real answer. What we are now recognizing clearly is that skin has a tolerance limit. It can correct itself, regenerate, and respond beautifully, but only when its protective systems are intact. When the skin barrier is repeatedly disrupted, even by individually excellent ingredients used with genuinely good intentions, the best skincare in the world stops behaving the way it is supposed to. The barrier is not just a surface layer. It is how skin decides what stays in and what stays out, how inflammation is regulated, how water is retained, how healing happens, how the immune system at the skin surface receives and interprets signals. When the barrier is compromised, skin becomes louder, it reacts faster, it over-responds to things it previously tolerated without difficulty. This is why people suddenly feel stinging from products labeled gentle, why pigmentation becomes unpredictable after years of stability, why post-procedure recovery takes longer than it used to. The skin is not being difficult, it is being exposed. And an exposed skin does exactly what a compromised protective system does. It sounds the alarm constantly because it no longer has the resources to regulate quietly. So what is the shift that is actually happening? And what does it mean practically? It is called microdosing, and it is not about abandoning active ingredients. It is about respecting how often skin can realistically process them. Lower concentrations used consistently outperform higher concentrations used aggressively. Fewer applications with proper recovery between them outperform daily intensity. Planned breaks allow the barrier to rebuild between demands. Pairing actives with ingredients that support recovery, rather than stacking actives with more actives, creates a routine the skin can actually complete rather than one it spends all its resources defending against. When this is done correctly, something interesting happens. Skin calms down, hydration holds better, texture smooths out without the irritation that was previously the price of every improvement. People tolerate treatments again that had stopped working. Post-procedure redness resolves faster, and skin becomes predictable, which is something many patients have not experienced in years and did not realize they had lost until it returns. That predictability is not a small thing. Skin that is not constantly inflamed creates a healthier environment for collagen. Aging becomes slower and more gradual rather than accelerated and reactive. There is less need to correct things because fewer things spiral out of control in the first place. The whole system becomes more cooperative because it is finally being given the conditions to cooperate. Here is the part that requires a genuine mindset adjustment, especially for people who are accustomed to dramatic signals as proof of progress. Barrier repair does not announce itself loudly, it works quietly. You notice it in what stops happening: less irritation, fewer flare ups, more tolerance. Products that cause problems begin causing no problems. Recovery after stress becomes shorter. The skin simply behaves steadily, day after day, without requiring constant management. That absence of drama is the result. And once you recognize it for what it is impossible to mistake for stagnation. Routines are changing to reflect this. Fewer products with greater intention. Built-in rest days rather than constant intensity. Seasonal adjustments rather than the same aggressive protocol, regardless of what the skin is going through. Sunscreen understood not just as anti-aging, but as daily barrier protection. More professional guidance informing decisions. Less independent experimentation, driven by whatever arrived in the algorithm that morning. The people this resonates most immediately with are those who feel like their routine has become complicated without becoming effective. Sensitive skin, over exfoliated skin, people using prescription actives, anyone recovering from procedures, adults noticing that skin is responding differently to stress and hormonal shifts than it did 5 years ago. But honestly, the underlying principle applies to anyone. Skin is not meant to live in a permanent state of correction. It needs time to repair, regulate, and rebalance. When given that space, it becomes stronger, not weaker, more capable, not more dependent. This shift is not about fear or restriction. It is not about abandoning results. It is about maturity, understanding when intervention helps and when it quietly undermines everything you are trying to build. The most optimized skin Dr. Lazuk sees clinically is not the most aggressively treated, it is the most stable. And once someone experiences what genuinely stable skin actually feels like, calm, predictable, comfortable, resilient, it becomes very difficult to go back to the cycle of intensity and recovery that preceded it. Because stable skin is not a compromise, it is the goal. It was always the goal. It just took the field a while to say so clearly. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice or a clinical recommendation for your individual skin situation. Barrier health, microdosing protocols, and routine adjustments are all highly individual and deserve professional evaluation before changes are made. Please consult a licensed dermatologist for personalized guidance. Dr. Lazuk and our team at Lazuk Aesthetics in Alpharetta are available to help you find the approach that is right for your specific skin. Dr. Lazuk will return from Vienna as soon as the curriculum revision is finalized and someone reminds her with sufficient conviction that we are waiting. May your skin always glow as brightly as your smile.